right, everyone. Looks like it's 2 o'clock. We can get started. I see this is a smaller group than usual. This is, I think, the last calendar invite that was on our schedule. Due to that, I will be sending out a new calendar invite with either bi-weekly meeting or not bi-weekly meetings, but meetings every 2 weeks or once a month. We're still trying to determine on our end the frequency of these meetings. I know the last one that we had was about 2 weeks ago. The reason for this one as well is there's a lot changing. A lot's happening when it's on the COVID front, especially over the course of the last month. So I'll just get into it. Numbers that we're experiencing here. Total cases for Fresno County is 110,523. We've been seeing cases upwards of 260 to 300, 350 upwards. It's significantly higher than a month ago, and this is on a daily basis. Our average cases, just looking at today's numbers, is about 31 cases per 100,000. Obviously, there's no delay or lag in there, so that number will change in 2 weeks. But just looking at today's numbers, it's 31. I know we've always get the request for individuals asking us if we were still in the blueprint metric, where would our numbers be? So if we were looking at the 2 week or 7 day average with the 7 day lag numbers, Fresno County, as of today's numbers, would be at 28.5 cases per 100,000. If you remember back, anything higher than 10 is considered purple, and we're well above that at 28.5. Our positivity rate for Fresno County is 10.7, significantly higher than numbers we've experienced in the past. And then just looking back at historical data, the numbers that we're currently seeing are very close to the numbers we were seeing in late part to mid-February. So that's, if you remember back, our highest peak numbers that we've seen in COVID were right around New Year's time. January, they were still significantly high. And even in February, they're starting to get lower. But as we went into March and then April, the numbers significantly came down. But the numbers we're seeing right now were pretty equivalent to what we were seeing back in February. And if you remember back, a lot of stuff was still shut down at that point. And then I just want to mention hospitalization rates too. Those have gone up significantly. Weeks past, right around 4th of July, those were some of the lowest numbers we had seen in quite some time. I believe the numbers were closer to about 30 or even below that at one time. Now cases in the hospital cases are 327 as of today. And the significance of that is you have to remember back our hospital system. Once you start straining it with more individuals in ICU or just visiting the hospital because of COVID symptoms, you're really putting a strain on the capacity of who and how and what the hospitals can address at any given time. And then going back to deaths as well, just kind of going back on the numbers. We get a lot of questions surrounding the fact, hey, well, our cases are going up, but we're not seeing deaths. What we've seen with this virus is you get the initial virus, you get a lot of individuals testing positive, so you see a lot of the cases, and then it takes a few weeks before the deaths start catching up. So you have to remember certain individuals that get sick at this given time might be in the hospital for a week. They might be for an extended period of time. But that's where the death typically occurs. And that's why in the prior waves that we've seen, you'll see a large influx of cases. And the longer you're into the wave, that's when the deaths number will start to go up significantly. And Dr. Zweifler, did you want to touch on any of that in regards to hospitalization, deaths, and so forth?
Well, you described it pretty well. So yeah, it's usually a couple week pause after the surge of cases, and then the surge of hospitalizations, the more ICU, and then finally the deaths about 6 weeks after we see the surge. I think we can expect that the actual number of deaths will be less than we've seen with other surges, just because we've so many of our high-risk individuals have been vaccinated. But Delta, it's not clear that it causes more severe disease, but what is evident is that it is more transmissible. That seems to be related to the fact that we see much higher viral loads in those who are infected with the Delta virus when compared to some of the earlier strains.
And then I know we had a discussion this morning. Dr. Vora on the medical provider call mentioned just some of the predictions or forecasts of where we're going with this wave. Did you want to touch on that very briefly on what's forecasted, what's predicted, and where we're currently at?
Yeah, so the state of California is able to do modeling to predict where this surge is likely to go. So we're not 100% certain, but the modeling suggests that we're still on an upward trend here in the Central Valley, and that we can expect the number of cases to peak sometime in early September. And then we would see the hospitalization surge peak, a week or two after that. So we're looking at into mid-September that we would hope to see some declines. The timing of all of this is a challenge as well, with the opening of particularly with the start of the school year, which also can contribute to transmission.
Thanks, Dr. Schleichler. Just moving on to vaccines, just total number of vaccine doses administered. In Fresno County, we're approaching that 1 million mark. Total, if you're just looking at the county, this includes all age groups. We're about 49.7%. So we're right at that 50% for the entire county. But then if you look at eligible population, that means it's individuals 12 years and older, all the individuals that are eligible to get the vaccine. We're about 60% of all Fresno County residents have received at least one dose of the vaccine. And that number over the course of the last 2 weeks has started to rise. I know we hit a period of time where the number was a little bit more stagnant. We didn't have individuals lining up at vaccination sites. But over the course of the last 2 weeks, we've seen that number go up. Me personally, I've been out to a couple of vaccination clinics that we've held. We had a lot of individuals that returned for second doses. But during those second dose events, we had a lot of individuals that said, hey, yeah, I came by, but at that point I was hesitant on getting the vaccine. But since they are seeing an uptick in cases, they were more inclined to get the vaccine at that time. So we saw a lot of individuals at first deferred, but then when we went out for the second dose, they actually wanted to receive the vaccine at that given time. And we're seeing a lot more of that across all of our clinics. And then just further going into it, our model when it comes to vaccination clinics, I know we had mentioned this prior. Individuals were used to the large mass vaccination clinic sites, similar to the one that we had at Fresno Fairgrounds. What we've done is we moved kind of away from that model. We have a lot of providers on board, which can have, and they do have the capacity to provide vaccines as well. So there's multiple outlets, so you don't necessarily have to go to the large vaccination site to get the vaccine. Instead, you can defer to your local pharmacy, you can defer to your local physician or any clinics. We still have multiple clinics going on as well, like smaller events that we've held at parks and so forth. But in that capacity, you're not necessarily going to see the large mass vaccination sites, but you will see the smaller pop-up clinics and so forth taking place. And on my end, that's most of the updates from my side, Dr. Zweifler, unless you have any. Or we can take any questions from the group as well.
Well, just to stress what are the strategies we have available to us. So the surge is very real. For example, with the schools, we're seeing many more cases than when we saw last year, and I think it just was reflective of the degree of the case rates in our communities rather than on the schools themselves. So it's very much out there in the community. The mitigation strategies we have, particularly in faith-based settings, is wearing a mask and being vaccinated. It's hard to have the services outside, particularly with the smoke and the bad air that we have right now. So now more than ever, ensuring that everyone's wearing a mask. And for as many folks as possible getting vaccinated. And I'd be happy to answer any questions that folks might have. There's, I guess the biggest news on the COVID front, apart from the surge, is the recommendation for a third vaccine. So more information to come on that. But again, particularly in faith-based settings, ensuring that folks are masked right now is, I think, the most important step we can take.
Then Dr. Zweifler, do you want to mention immunocompromised for third dose? Because I know certain individuals will already be eligible for the third dose. If you just want to provide some comment to this group.
Yeah, no. So as Sim mentioned, if you are immunocompromised, you're eligible to get the third dose already. What we've seen, and the reason that recommendation was made, is that individuals who are immunocompromised, so folks who are on medications that suppress the immune system, who have autoimmune diseases or some type of cancer treatments, they're not as able to generate an immune response. And so what we've seen is that with the vaccine, it's not as effective at raising antibody levels as they are in most individuals who get the vaccine. So for those individuals, a third shot is recommended, and they can get that now. So it just needs to be 4 weeks after their second shot. The announcement from the White House recently was that now, even if you're not immunocompromised, that you'd be eligible to get a third shot. And that program is slated to kick off after September 20th.
It looks like we have a question in the chat too. It's in regards to the new gathering, the blueprint for industry business sector guidance. Is for large events. I'm not sure if you had a chance to review that. Dr. Zweifler, you can comment.
Well, yeah. So, we've talked about this on the calls before. What are the highest risk situations for respiratory transmission of a virus? Well, it's in areas where you're indoors in crowded settings. So that before, the state had said, well, it's so, the most dangerous situations are going to be where you bring large groups together indoors for events. So the standard was, if you had a mega event of more than 5,000 individuals, you were expected to either see proof of vaccination or a negative a negative COVID test within the last 72 hours. So what they basically said is, first of all, that, well, three things. They've reduced that number from 5,000 down to 1,000. And at the same time, they've said that you can't just self attest to having the vaccine. You need to have actual proof of vaccine, and so that can be having your COVID card, having a picture of your COVID card, or having a printed version of your COVID card, or being able to access the online verification of your COVID card. that you completed the vaccinations. What they also said is that this did not, the requirement did not apply to churches, but it was strongly recommended that churches follow that same guidance. And for the reasons that we've talked about, that again, in crowded indoor settings, you're just that, that's where the virus is most likely to spread.
Looks like there's a thank you from the group. Looks like another question came through. In this new wave, have you seen an increase in percent of hospitalizations among children under the age of 12, especially those that are without comorbid conditions?
Well, we see reports out of Texas and Florida that basically they're out of ICU beds for children. So this particular wave does seem to be affecting children more, whether that's because in prior waves it was mainly circulating among those who are most vulnerable, whether that's related to school reopenings, particularly without masks, or whether this particular virus is that children are more prone to it. It's hard to say, but we're seeing increases in the rates in all age groups, but as well as with children. So as far as the data regarding comorbidity, I don't have that information at that level of detail, but there are more cases in the hospital. Like I said, in Texas, they were reporting and having no ICU beds in the state for children. So it's a scary time. I know Valley Children's has been very concerned about this. I was on a call with them the other day, and they were reporting that they had nine kids in the hospital and 4 in the ICU, which was their highest numbers that they've seen. And again, we're seeing a lot of cases being reported from our schools as schools starting as they're screening for symptoms. So whether this is just among those with comorbidities, we don't have that data, the data drilled down to that level. I wish we did, but we don't have that degree of specificity.
Thank you, Dr. Zweifler.
And the other issue with the kids is, of course, it's even though they are generally healthier and like adults, they're less likely to get sick than our most vulnerable populations. But they can transmit it to those who can get sick. And what we are seeing across the board is just the younger people are getting admitted to the hospital, whereas initially it was our elderly or skilled nursing facilities. Younger and younger individuals are getting hospitalized. Younger individuals are dying as well. So I think partly that reflects the fact that those who are most vulnerable are vaccinated, so we're not seeing them in the numbers. But I think it also speaks to that the Delta variant is more transmissible, and so we're seeing it spread very rapidly in populations, particularly those who are not vaccinated.
And I wanted to share a statistic from yesterday's CDPH. So California Department of Public Health, they have their typical news releases, but yesterday they highlighted a significant number. So for the week between August 9th through the 15th, the average case rate among unvaccinated Californians was 51 per 100,000. So that's 51 cases per 100,000 of those that are not vaccinated. And that case rate for individuals that were vaccinated was significantly lower, only 7.6 per 100,000. Obviously, you have some breakthrough cases and so forth, but that significant difference between 51 cases per 100,000 and 7.6, all with just receiving the vaccine.
Yeah, I saw some similar data, and basically what it showed is that about 90, your chances of getting COVID of Delta or of being in the hospital were about 10 times as high if you were vaccinated, if you were unvaccinated versus vaccinated. So, again, we've seen different types, seen different numbers. Hospitals are encouraged to report and to submit data on whether to submit COVID specimens to be sequenced to determine whether they're not their Delta variant. But what we're seeing is, about this 10-to-1 ratio in the state of California of those who are getting sick if you're not vaccinated, you have about 10 times the risk of getting infected or ending up in the hospital. And I suspect we'll see similar trends or even more dramatic trends as it relates to deaths.
And Dr. Vora, this question comes up, it came up in media briefings as well, and from the general public. If you go in for a COVID test, are they testing for variant or are they just testing for the virus itself? Like, how do they determine if you have the variant or not?
Yeah, they're just testing for the virus itself. In order to determine whether or not you have Delta, the specimen needs to be sent off for what's called whole gene sequencing. So that can be done with the PCR test, not with the rapid antigen test. So that's not done routinely. Hospitals have been asked to submit all their specimens of their hospitalized patients for whole gene sequencing, but we're not seeing that yet. Or not seeing that data yet. It takes several weeks to process those. But what we do know is of those that have been of the whole gene sequencing that we get back, the vast majority are Delta. So it's pretty much Delta has taken over the COVID world. So well over 90% of cases now are Delta. So whether there's a smattering of what's called Lambda, and the significance of that is not really clear yet. But one of the big concerns is that the longer this sticks around, is that the virus can continue to mutate and potentially a more serious strain could emerge. But right now it's almost entirely Delta that we're dealing with.
Thank you for that. I just wanted to make a note. We've sent out a request to this group as well, and several folks that are linked to this group on if they're interested in hosting a vaccination site. I know several faith-based organizations took us up on that offer, and we're glad to have worked with them. They even held second dose sites and so forth, but we're expanding it again. So our team is just looking for different sites. And this doesn't just apply to faith-based organizations. If you have a business outside of the faith-based organization, let's say if you have a side business or factory, whatever it may be, or you have friends or family that may potentially own or work with a different site, we'll work with them to host a vaccination clinic. I know we've had several over the last few weeks where we actually went out. Employers asked us to educate their staff on the vaccine. At that point, we scheduled 2 vaccine clinics, an initial one and a second dose one. And the uptake at those clinic sites is pretty significant. So if anyone is interested, just go ahead and email us. You can reply back to the calendar invite, or we do have that information up on our vaccine page as well. There's actually a short survey form that you can fill out with just basic information where our team can reach out to you, or if you have a proposed site or an individual, you can post down their information and we'll reach out to them. And hopefully we can get a vaccination site at that location. I think that would be it from updates from the Department of Public Health. If anyone on the group has any questions, you guys can unmute yourselves, or you can put it in the chat. Looks like the group is quiet. If you do have any questions, just go ahead and email us. I want to thank Dr. Zweifler for being on the call. Thank you for taking these questions. But if you guys do have any questions that come up, just email them over or contact us. I know we recorded today's session, so we'll post this as well and share it as well. And then as far as calendar invite goes, I'll send a renewed one. We'll determine if this needs to be every 2 weeks. So if you guys can give us feedback now, if you guys are open to doing these every 2 weeks, once a month, whatever works best for you guys, we can go based on that. I know right now on a weekly basis, there's a lot of stuff coming out. So I don't mind the every 2 weeks because there's significant updates, especially for the next few weeks. All right. Want to
Thanks,
thank
Sam.
everyone. Thank you, Dr. Z. I want to thank everyone for being on the call. Looks like we're getting 2 weeks, every 2 weeks. Okay, I will send out a calendar invite for every 2 weeks. Just be on the lookout for that. And you guys can also share that with any other faith-based organizations that you guys are linked up with, so we can get a little bit of a larger group in attendance. Once again, Sim Dillon, Dr. Zweifler, Fresno County Department of Public Health. We want to thank everyone for being on the call. Thank you.
Bye.